की देखिए मॉरल ड्यूटियां हैं, जहाँ जो निभा दें वो बहुत अच्छा है। सो आई विल
जी जी
ट्राई माय बेस्ट के कोशिश करते रहते हैं विद अवर
जी
टीम इंस्टीट्यूट, और जो भी अपने पास स्किल है एज एंड व्हेन रिक्वायर्ड तो उसको हम जरूर कंट्रीब्यूट करना चाहते हैं।
जी जी जी
एंड
एंड
ऑल इज वेल,
Pooja
सब
ma'am is
कुछ।
my teacher.
जी थैंक यू, गॉड ब्लेस।
इट्स रियली सर, आज बहुत खास दिन है मेरे लिए। इन लोगों से मैं बहुत साल पहले से जुड़ी हूँ, करीब करीब 15-16 साल हो गए, और इट्स रियली मैटर ऑफ प्रिविलेज फॉर मी टू हैव माय स्टूडेंट डॉक्टर नेहा विद मी टुडे. So, sir, with your permission, can we start the webinar right now?
कंटिन्यू प्लीज, यस।
Okay, okay. So, a very good morning to all of you, and I welcome all the audience, and particularly my speaker for the this series of webinars that is conducted by IQAC cell of ISF College of Pharmacy, Moga. So today we have Dr. Neha Jain with us as a speaker, and I'm really thankful to her that she has agreed on such a short notice for the lecture. Let me take the opportunity to introduce Dr. Neha. Dr. Neha is currently working as assistant professor in Amity Institute of Pharmacy, Amity University, Noida. She is also joint secretary SPER Women Forum. She has 12 years of teaching and research experience, and she is very active academically as well as from research point of view. Her core research area is the development of novel drug delivery systems like polymeric nanoparticles, lipoidal nanoparticles, transferosomes, hydrogels, and in situ gelling systems. She has published several papers in international journals of repute and earned an H index of 18 in such a short span. So, really, Dr. Neha, I welcome you for your lecture today on this platform. Thank you so much, and we can start for your lecture right now.
Thank you so much, ma'am, for introducing me. It's really a proud moment for me when my teacher is introducing me in such a graceful manner. And there was no option that I can deny you in such a short span. So,
Thank you so much, Neha. Thank you.
welcome, ma'am. Now we are starting. Shall we start, sir?
Yeah, sure, sure.
All right. I'm just sharing my screen.
Okay.
Ma'am, are you able to see my screen?
Your screen is available, but your presentation is not there right now.
Uh, just a minute.
You go to present screen, and what you have selected, the new tab or the entire window?
No, window is I'm taking. Just now it is visible to me. I hope it is visible now. Ma'am, is it
Yeah,
visible?
yes. Bilkul.
All right. So, my sincere greetings to everyone. I'm very thankful to the management of ISF College of Pharmacy for inviting me to this webinar. So, here we are just starting the interaction on advancements in drug delivery strategies and then and now. So, basically, when we talk about advancements, it means something we have in our basics. So, we have to just go for our basics and then we will be coming to the advancements. What are the drug delivery strategies? Like we had already gone through, when we fall ill, doctor always prescribe us some formulations like tablets, capsules, or injections sometimes when the condition is not able to control. So these all are the drug delivery strategies or the dosage forms that doctor prescribe us. But he uses different routes, like he can give us through the oral route or through the uh, your parenteral route. So different routes are selected based on their viability of the formulations. Then coming different dosage forms, like the doctor will decide how the patient will be treated, that he is in such a chronic condition or an acute condition. Accordingly, he will decide that which kind of dosage form we can give, we can prescribe. And then coming to the different techniques, like through nasal technique he is given, or through some other techniques, like when we talk about the transdermal delivery, so there is thermal ablation. When we talk about the cancer treatment, there is radiation therapy. So different techniques are being there, already being developed for curing the several diseases. So, but now the question arises, why we need to the advancements in drug delivery strategies, what the problem are there. So whenever when we feel sick, when we fall sick, then only we go for some treatment. But what is health? When we say that we are not feeling well, health is a state of complete physical, mental, social well-being, not merely the absence of disease or infirmity. Whenever you feel sad, you feel like I'm not feeling good, that is also a problem to you. You just nowadays generation say that we are in depression, that person is in depression. That is also a condition when we feel we don't feel good. So that is also condition of being sick. So, when a single individual is physically fit, mentally fit, socially fit, and psychologically fit, that is a complete healthy person. So, what changes have been there that results in the advancements for the drug delivery strategies? First problem is the changes in the disease pattern. All of us have already studied, like in the past there were some diseases like cholera, diarrhea. These were the diseases only because there were very poor hygienic conditions that results in these disease conditions, and that were easily curable with the help of vaccinations. Later on vaccines develop, but in today's scenario these diseases are not the main problem. Main problem is our lifestyle that causes or that made us sick. So if we look after our lifestyle, definitely these advancements are going to help us. Otherwise, nothing is going to help us for a better health. Apart from the changes in the disease pattern, there is a condition that is known as patient incompliance. Whenever doctor give us a therapy for 5 days or 6 days, we have tablets or the given therapy for 2 to 3 days and then we feel good. We immediately stop that therapy कि अब तो ज़रूरत ही नहीं है लेने की, हम तो ठीक हो गए. But doctor has given a complete regimen so that you can get completely well. Your symptoms have been blocked or cured, but definitely the root cause has not been cured in that span of time, that in minimum span of time. That's why he has prescribed you 5 to 6 days. So that incompliance is there. Why patient incompliance is there? If I talk about the oral route, so kids say that the tablet or the syrups are not tasting very well, we'll not take it. When we talk about the geriatrics, they have their aging conditions, they forgot to take it. So that patient incompliance is there. So we are doing advancements so that we can increase the patient compliance. Once we increase the patient compliance, definitely the disease is going to be mitigated in a short span of time. Next point is enhanced therapeutic efficacy. Currently, simply when we talk about fever, in fever we have to take paracetamol 2 or 3 times or 4 times a day. But when we are outside, when we are in some working condition, in meetings, we forgot to take that particular medicine. That causes us to fall more sick or the condition get more worse. So that therapeutic efficacy of that tablet is reduced because of our patient incompliance. So to enhance the therapeutic efficacy, we are searching for the advancements. Like nowadays, implants are there, patches are there, which can improve the therapeutic efficacy of a particular dosage form. Drug repurposing. It takes a long time for a drug molecule to come into the market, like 30 to 40 years or more than that. It takes time. So, already available drugs are there which can be checked for more indications. Like when we talk about the aspirin is very famous. Everyone knows about it. Like it has been given as a painkiller in the past. But in the last few years back, it has been repurposed for its antiplatelet effect. It has been used for the heart attacks. Apart from this, minocycline is there, which is a good antibiotic, but now has been explored for its neurodegenerative diseases effect. So it can be used in multiple sclerosis also. So these advancements are there. Like drug repurposing is a kind of advancement which has explored the already available drug for the new indications. And the last is to reduce the healthcare cost. India is a developing country, so we don't have much funds for our health. Even we don't focus on our health. Whenever we feel sick, we just go to the nearby medical store, we take the tablets or the medicines from them, and then we just administer it. We don't even know that what symptoms we are having, and what can be the consequences of these symptoms if not treated. So you can see in this graph also, risk of chronic disease is increases when there is no intervention. While when if you have any symptoms at the maternal or early age, child in adolescent age, if you take proper intervention at that time, definitely your age will increases and you will be living a healthy life. So to live a healthy and sound life, we need advancements. Before coming to the advancements, we just focus the history of diseases and interventions. Here you can see the past, present, and future of the diseases and its interventions. The past, the diseases were the cholera, plague, smallpox, and influenza. So at that time, what the people used to take, they used to have herbal extracts. They make decoctions, basically commonly known as kava. They took that and they drink it. But definitely, because of this lack of the standardization of herbal extracts and the toxicity perspective of the herbal extracts, they were not so much effective. Then our scientists worked very hard and they find out the vaccination as the solution for these maximum of the diseases. And now these are no more a big task for us to treat them. But now coming to the present condition, the diseases are lifestyle disorders. Like we all, almost in every home, we have diabetic patients, high blood pressure patients, and microbial infections are there. PCOD is very common in the females. So these all are the present diseases. How they have emerged, how the trend has been changed because of our activities. All of us have, like in early times, what the females used to do, they used to make flour at home only using that chucky. But now we are having the packaged flour, which has a lot of preservatives. So a shift in physical activity is there. Physical activity has been reduced so much, due to which the problems in the body has arisen a lot. Earlier, the people were used to draw water from the wells, which takes your complete body is involved, your muscles is involved in taking out that water. But now motor is there, just you have to switch it on, you can fill a lot of water. So a lot of things are there. Our culture, our religion, everything is changing, shifting to the modernized era, and due to this we are having lifestyle disorders. If I normally talk in the, like in some of the religions, it has been said to have meals before 6 p.m, before the sunset. It has a logic was that normally the individual is going to sleep by 9 p.m. So in these 3 hours, like if you have meal at 6 p.m, in these 3 hours between 7, 8, 9, the food is going to be digest very easily. But nowadays, we all have very late night dinners, due to which the digestion doesn't occur properly. And when the digestion is not there properly, how the nutrients are going to be absorbed, how the excretion or metabolism will take place. So that is ultimately resulting in obesity. So these all are the lifestyle disorders. Coming to the microbial infections, how microbial infections are emerging? Because our immunity is very less now. We are not immune to the changing climatic conditions. Pollution is rising so much. Environmental conditions are contaminating now. These are the present conditions. So interventions are synthetic drugs have taken place of herbal extracts, and different dosage forms are there. But still high BP, diabetes, obesity is still a big problem to everyone. Even the small kids also have obesity problem because they have more screen time, less playing time, which was needed for their proper physical and mental growth. So now the future of diseases, see the concerns are there. Chronic diseases will be there. antimicrobial resistance will develop. Why antimicrobial resistance will develop? Because when we have cold, when we don't get cure within 2 days, we start the course of antibiotic like azithromycin, and even we don't know the significance of completing the dosage regimen of antibiotic. That leads to the antimicrobial resistance. In near future, researchers are predicting that antimicrobial resistance will be a big problem for the doctors, like which antibiotics they should give to the patient to cure the particular infection. That is a major concern. Climate related changes will be very high, like nowadays wars are going on, that is contaminating the air so much. So definitely how they are going to affect us, they will be going to affect us in our physical structure, the changes in the physical structure. Mentally we are feeling very fearful and stressful. Mental disorders will be there. We are, like, if I talk about the mental disorders, currently youth is the one which is suffering from depression a lot and are on antidepressants also. Why they are antidepressants? Why the kids are having depression? Because they are not in the joint families, they are in proper in the nuclear families where the both parents are working and they don't have time to discuss anything with the kids. So kid is getting alone and isolating himself or herself. Earlier there were the concept of the joint families, even you don't get the time कि आप अकेले बैठ भी पाओ. So that results कि कोई भी depression में नहीं होता था. Everyone was happy, they were fighting and enjoying all things together, all festivals together. Genetic problems are there because our genes are getting changed, getting mutated. Like in some research I have studied, like in future the females will not be able to deliver the kids normally because the genes are changing, the genes are not able to tolerate that pain, that much pain. Even the kids are also, they don't have the capacity to bear that pain. Digital health related problems will be there. We are having more screen time, which reduces the physical growth of the kids as well as the mental growth. They don't have mental games, they don't have physical games. So these are the future of the diseases. As and when we have shifted from the past to present and the future of the diseases, definitely interventions need the advancements. So interventions like targeted delivery and personalized medicines, these are the future of the diseases or drug delivery strategies. Now coming, why the pattern of disease shift since last few decades? These are the some reasons that due to which the pattern of disease have been shift. According to these shift, the drug delivery strategy has also been changed, has to be advanced in such a manner. Plus, when we are advancing with the drug delivery strategies, we should also focus like what lifestyle changes we should maintain so that that advancements can also work upon us. Otherwise, these advancements will also stop working on our health. Like lifestyle changes is there, changes in the dietary habits. We are having processed food which doesn't have much nutrients but have a lot of preservatives in India uh, things into it. Physical activity levels are reduced, sedentary lifestyles are increased, like students are also having more laptop time, tablet time, and these mobile times. Aging population is there, so age related diseases are there. Earlier the aged people, geriatric population, doesn't have neurodegenerative disorders. The cases were very few, like 100 out of 100, 2 or 3 were there. But nowadays neurodegeneration has been increased so much. Environmental factors, the pollution and the climate change. Earlier, the winters were of 6 months, but now we have just faced the winters of 2 or 3 months. The hardcore winter, that is only of 2 to 3 months. Why? Because of the extreme pollution, which has lead to the temperature increment. Then coming to the healthcare advancements, there, yes, certainly there are some certain advancements in the medical research, like ultrasound facilities are there, MRI, CT scan, these all are there. Taking a simple example, during the pregnancy, earlier ultrasounds were very few. During whole the 9 months tenure, only 1 or 2 ultrasounds were prescribed. But nowadays, 4 to 5 ultrasounds are there. Ultrasounds are basically using the ultrasonic waves, which may affect the fetus also. So this is right that we all are conducting these diagnostics for the betterment of the fetus so that we can have a healthy child. But definitely it is going to degrade their health also, affecting their parts, their body parts. also. Coming to the antimicrobial resistance, as we have discussed earlier, as we don't know how to administer antimicrobials or antibiotics in a proper manner, in a proper schedule or dosage regimen, that results in the antimicrobial resistance. Behavioral health, that results in mental health issues. The students are not communicating with their parents, parents are not asking their problems, students are not communicating with their teachers, with their peers, with their friends. That may leads to the behavioral health issues. And definitely if this continues, then in certain future it will happen that all are keeping mum. Like if you go in some train or bus, you will face that everyone is looking in their mobile rather than talking to each other. So we have increased our screen time. We have involved in ourselves only. That results in the behavioral degradation in the behavioral health. And the last is the globalization. We are traveling from one place to another place, which results in the transmission of one disease from one country to the another country. The corona is an example. COVID-19 is the best example of that globalization. So these are the factors due to which there is shift in the disease pattern. Now coming, what is the aim of drug delivery strategies? We are not looking after our lifestyle, but now we are more focusing that how we can improve the treatment. So now we are watching the points like controlling drug pharmacokinetics. Pharmacokinetics means controlling the absorption, distribution, metabolism and excretion of a drug product, so that we can have maximum viability of a drug inside the body, maximum action of that particular drug inside the body. Reducing drug toxicity, this is the another concern we all have, because the drug is basically a synthetic moiety, and a synthetic moiety has two kind of effect, a positive and a negative. Positive effect is the therapeutic effect, and the negative effect is the side effect or the adverse effect. So that toxicity has to be reduced. Improving patient health by enhancing the delivery at of the therapeutic to its target site. Like when we talk about the chemotherapy is given inside the whole body through intravenous route. So in the chemotherapy, the drugs doesn't recognize the cancerous cells, as well as they also act on the healthy cells. So that's the reason the chemotherapy patients, the patient which who are on chemotherapy, get their health very much degraded. Minimizing off target accumulation, so that we can have particular targeted effect, and facilitating the patient compliance. These are some of the aims, and keeping these aims in our mind, we are going to advance the drug delivery strategies. So this is a complete slide. This slide completely shows like how from 1950s and up till 2030 the advancements have taken place. The basic aim is to avoid the fluctuation in the plasma concentration of drug. So here you can see in the diagram there is a control release, sustained release concept, which has avoided the modulation in the fluctuation in the plasma concentration. So have a proper pharmacokinetic profile of a drug inside the body. These changes have taken place. Here you can see in 1952, spatial resolution control concept was launched, which has helped a lot to increase the stay time of drug inside the body. Then OcuCert has evolved, like diffusion controlled formulation was there, which has controlled the diffusion of drug from the formulation. Then 1974 also iron dextran complex were there, and then Oros concept was there. Ion exchange resins were used to control the drug release. Transdermal patches were introduced in the 1979 for scopolamine to have an anti-nauseating effect, antiemetic effect. Then in 1989, Lupron depot was there. In 1990, Norplant, which is an implant, or you can say it's an contraceptive implant, was there. And then from 2000 to 2020, we have a concept of nanomedicine, which is currently going on. We have a lot of formulations in the market which are based on the nanomedicine, like Milotag, it's an antibody drug conjugate, Rapamune, which is a nanocrystal formulation. These are nanocrystal based tablets. Rebilisis, which is an oral peptide tablet. Paclitaxel in pegylated castor oil was there. It is an injection basically. Adagen, pegylated protein, Movantic, pegylated naloxone, and then RNA has also been delivered from the lipid nanoparticle. RNA is basically nucleic acid, ribonucleic acid, which has been given through in injection through nanoparticulate formulation. Doxil, Chimera, Comirnaty. So these all are the advancements which have been taken place since 1950. Now coming to the future prospect. Here you can see small molecules like drug molecules are being modified to enhance the drug delivery. Peptides and protein drugs are also being taken. Site specific targeting has also been a major success. And to cross the biological barriers, like triple B is the biggest barrier to cross. Even we are able to cross it now also. So these are all the evolution in the drug delivery system since the last few decades. Now coming the five generations of therapeutic molecules. You can see here five generations. Small molecules like drugs which have molecular weight less than 700 daltons, like chemotherapeutic antibiotics are there, steroids are there, antibodies are there. The second generation in which monoclonal antibodies which have been developed for the treatment of cancer, rheumatoid arthritis, and many of the autoimmune disorders. Proteins and peptides are also being given, like albumin, which is already present in our body, has also been explored for its potential in the drug delivery for many disorders like cancer, rheumatoid arthritis again. Nucleic acids are also being given. Live cell therapies like CAR T cells therapy. This is the new one. In 2018 or 19, this has been approved for the therapy. Basically, in this, the T cells are taken from the body of the blood plasma of the patient, and then modified and then injected again in the same patient for the targeted treatment. These are the paradigms of drug delivery. See this shiftings. These are the three paradigms basically: drug modifications, environmental modifications, and the last is drug delivery systems, modifications in the drug delivery systems. Drug modifications, drugs are being modified, like we can attach any functional group on the drug molecule to change its properties. Pegylation, PEG is polyethylene glycol, is an excellent molecule which has increased the capability of nanoparticles to reach the targeted site. Even with the help of pegylation, we can cross triple B also, blood-brain barrier. Antibody humanization, amino acid substitutions are there, targeting ligand conjugation, that is antibody drug conjugate are there, ADCs are there, stimulation differentiation, and genetic engineering. These all are the different techniques through which we can make different kind of drug modifications. Coming to the environmental modifications, we can modify the environment of our body also, which even in previous time we were not able to control. Like a simplest example, in diabetes condition, many of the patients have wounds which are not able to cure. So nowadays we have hydrogel wounds which are responsive according to the wound physiology. In the wound physiology that has low pH, more glucose concentration, when these conditions are there, hydrogel are going to deliver the drug at that condition only. So these are the environmental modifications. With the peptides, we are going to give protease inhibitors so that we can inhibit those enzymes which can degrade the peptides. So pH modification can be done at the particular site to have more release. For the permeation enhancement, endosomal escape can be done through the inverse targeting. Coming to the drug delivery systems, these are the plethora of drug delivery systems available for the future as well as present, like microneedle patch for enhanced transdermal delivery, microparticle depot. These are the basically injection which can release for 6 months to 1 year also. Transdermal patches, multiparticulate systems, coated microparticles, lipid based nanoparticles. These lipids are basically the eco-friendly lipids like phospholipids, and our cell membranes are also made up of phospholipids, so these are not considered as foreign particle inside the body. Polymeric nanoparticles, intrauterine devices are there, antibody drug conjugates, controlled release implants, inhalable devices are there, microencapsulation, cell targeting by identifying the receptors on the cell, polymer film, injectable devices are there which have vaccines in them, wound dressings Drug loaded contact lenses. Till now we are having contact lenses to increase the lens power, like these are the substitution to the specs. But nowadays these contact lenses have been soaked in the drug solution, and they deliver the drug for a long time on the ocular region. Swellable hydrogels are there. So these all are the modifications or the advancements in the drug delivery systems which are present currently. uh, these slides will help you to understand the advancements like nanotechnology based drug delivery, in which you can attach the targeting agents, bioactive cargo, you can have magnetic nanoparticles, we can have. Coming to the smart drug delivery system, why these are known as a smart? Because they respond to changes in pH, that's why they are smart. They respond to change in temperatures or physiological parameters. Telemedicine and remote monitoring, in earlier times we have seen in Ramayana and all, like then they just keep calm, meditate, and then they reach from one place to another, they can find out what other person is doing. So that is telemedicine in current situation. We have digital health platforms and apps which can monitor our health. Biodegradable implants are there for many of the disorders. And the last one is gene editing are there. Like I have just talked to you about the CAR T cell therapy. So they use basically T cells from our body and they modify it, and then delivery is done inside the body. Implantable drug delivery systems, these are the synchromed. This is a synchromed pump which is loaded with the drug and used for the drug delivery. Next one is transdermal drug delivery, use interferosis for the enhanced drug delivery. Targeted inhalable devices like inhalers and nebulizers, these were our support system during the corona time when we have a lot of pulmonary problems, like pulmonary fibrosis was there after the side effect, as in side effect of COVID-19. COPD problems are there, so inhalers and nebulizers are the biggest support at that time. And microfluidic fluidic devices, these are basically also known as point of care devices. They immediately take blood sample, they just show you the values, give the drug at that area, deliver the drug at that area. So these are microfluidic devices. So these are basically the advancements in the drug delivery strategies. Coming to the conclusion part, so a substantial shift has been taken place towards the sedentary lifestyle, like globalization is there, significant climate changes are there, which leads to dramatic alteration in the disease pattern. So advancements in drug delivery strategies are needed to respond to these changing disease pattern, so that we can have an optimized treatment outcomes, improve patient experience, their compliance, and address the evolving nature of health challenges. So these advancements in drug strategies not only enhance the effectiveness, but also open the doors to the novel treatments. We can think out of the box for the treatment of the patients, for the health conditions. Last but not the least, when we have already studied about the advancements in the drug delivery strategies, the major concern is we should be grounded to our the moral of this whole, the gist of this whole presentation is we should be grounded to our uh, moral and ethics. We should have a attachment to our religion, because our Vedas or our religious scriptures are rich in the things which can treat us. Spiritually we should be very much sound, we should go temples, have a positive vibe from there. Or if we are not able to go there, we should meditate at least 15 to 20 minutes a day to have a sound health. We should apply a positive attitude in our life. Good habits we should cultivate. How good habits to be taken, like nowadays generations are moving towards pleasured. So that should not be there. We should use our previous things only for fun or pleasure. Family should be there. You should be in touch with your family. You should be mentally, physically bonded with your family. And then you see the fruits will be a physical, mentally, social, spiritually sound citizen of India, who will be happy in stress-free life, prosperous nation, successful advancements in every sector will be there. So this is all about the advancement in the drug delivery strategies. Thank you so much.
Thank you, Dr. Neha. It was indeed a wonderful lecture because if I talk about myself, being a pharmaceutical chemistry person, you have given such a beautiful talk on these drug delivery strategies then and now. very efficiently you were successful to compare, like you have taken the retrospective as well as the future aspects of drug delivery systems. Thank you so much once again, and I am quite sure that the audience, the students of say B Farm or M Farm or any other class, any other course, they will be very much benefited by such a beautiful talk. Thank you so much once again. Really, it
Thank you
was
so much,
wonderful.
ma'am. Thank you so
एंड आई
much, ma'am,
रियली
for
विश्ड
giving
कि
me this
आई
opportunity.
रियली विश्ड कि ये अभी खत्म नहीं होना चाहिए, अभी और कंटिन्यू होना चाहिए. ब्यूटीफुल. थैंक यू सो मच. थैंक यू.
Thank you so much, ma'am. Thank you so much, ma'am.